Folks. Welcome to our webinar today. We are chatting about mental wellness in hockey and what we hope to see our associations and leagues doing in this space in partnership with what we are already doing and are planning to do at Hockey Saskatchewan. What I've heard a lot of in my role here is a lot of folks saying they want resources in their spaces, and we certainly want you to have them and share them with you. So my name is Faye Matt, for those who don't know, and I'm the Senior Manager of Culture and Inclusion at Hockey Saskatchewan. So in my role in my portfolio, I am meant to help enhance hockey programming on and especially off the ice. What are the ways we can make hockey a welcoming environment for everyone who's involved and ensure that everyone experiences joy while they are playing hockey. Today we'll go over some research and evidence-based recommendations on how sport organizations can enhance mental health programming and resources in their spaces. We'll talk about who's responsible for delivering those. We hear that a bit too about, aren't we here just to deliver hockey and do that the best we can? Well, of course we are, but I think in the best way possible, by enhancing the players' well-rounded experience. We all have a role to make that happen. So we'll talk a bit about where we're at today, where we might be down the road, and what associations and leagues and volunteers and employees can do. We'll talk about some opportunities that we've been reviewing and vetting here at Hockey Saskatchewan, the different partnerships that could be formed, different agencies and that have already come our way, and who and how you might do some evaluating of partners that are local to you. We'll talk about, making this a priority resource for your association and where we go beyond resourcing into next steps and forming some bystander policies. I hope to take about 45 minutes. We also have some friends from Saskatoon Minor Hockey Association who have been doing some work in this space to testify about their experience. So that's what our format will look like today. So we all know what players, coaches are experiencing in hockey. There is performance pressure that's coming internally. It's coming from families, others in their community. Just hockey has its own status as a sport, and folks put that pressure on themselves. So there's pressure to perform in the space, no matter what level a player is playing at. And there's also a link to individual mental health in hockey. Sport can be both a positive and negative domain for mental health outcomes. So by participating in sport, we can gain the tools, the physiological benefits that lead to good mental health outcomes. Yet they can also be environments where abuse and neglect can happen and create some negative mental health outcomes. So as organizers of sport, we need to look at both sides of that coin and how we can proactively support the benefits of playing a sport, and how we can barrier against anything that would put that in danger. And, we've in sport delivery really prioritized health, right? We prioritize safety and wellness. We wear equipment. We have rules that protect the safety of our players. And in this space it's why we need to consider that mental health is health. It's not a nice to do thing on the side. It's not an extra thing that we should do for coaches or for players. In the same way that we ensure that our facilities are safe and that our coaches are trained and that we are wearing proper equipment, we need to arm our participants with options to maintain their mental health. So in this conversation, I wanted to bring forward, like I said, some evidence-based recommendations. So I think we can all agree that there's certain things we want out of sport, but it's always nice too to reach into research and what's been happening in different spaces. So for this, we and also sort of in partnership with Hockey Canada, who is building their mental wellness platform out of this research that was brought forward by Sport Information Research Center, and really took a look at some recommendations coming out of an Australian community sport model that can be very comparable to how we operate in Canada, both with funding and structure. They took a look at what different ways community sport organizations can support mental health and came forward with some evidence-based recommendations that we'll take a look at together here. So the first is that mental health literacy becomes mandatory training for all adults who work with children. So that can look like a few different things. That can look like something that's embedded into our coach training in general. It could be something that's added on to coach training, but ensuring that there is literacy to recognize mental health needs for those who are leading sport. Mandatory mental health literacy training for others within the club. So some organizations would model this not only for their coaches, but have an organizer maybe on their executive committee, maybe a staff member, depending on the structure of their organization, who becomes that person in charge, that mental health officer, who can be a conduit for resources and help train folks who need that training. And literacy programs for all members. So as we keep that chain flowing, not only those who are leading, but are, in hockey, the teams are really supported by the families all around them, the managers, everyone involved. So ensuring that everyone has access to that literacy to make sure that everyone can notice the needs and also activate resources. Clubs should normalize conversations about mental health and provide a safe space. I think I have heard in my space here from some organizations, not to, create stereotypes, but to, in certain areas where maybe it's smaller communities, in particular, where there isn't as much literacy or resources provided as there might be in larger centers. There's still stigmas around mental health, what it is, how people need support for their mental health, and how that impacts how they play. So creating more conversations around it and normalizing the conversation as much as it is important to wear a helmet when you're on the ice. It is important to do the steps you need to take care of your mind, are just natural parts of the hockey conversation. When I talked about both the protective measures and the proactive measures, we can look at number 5 here, which is keeping our environments free from psychological harm. So obviously there's a lot of policy in place around this, a lot of structure in place around this, and yet we still see coaches who have that mindset of, yelling will get results, and using demeaning approaches will get results. And sometimes that's not questioned because the results on the scoreboard are being used to measure the positive outcomes for the team. And yet, just because we got there doesn't mean we haven't now caused some long-term psychological harm, or really fractured the experience for the player. So when I talk about free from psychological harm, it's both the really overt things that we have policies to protect, but there's still a lot of subvert ways of operating that can be captured in that bullying statement. Sports should include a psychologically healthy environment that promotes mental health. So this is the preventative pieces. So not only are we, training our coaches how to identify situations that could be harmful, but also are we talking together about having social connection, what community service aspects are supporting the team. Community service can be a great way for teams to gain confidence and social connection, which is going to certainly result in good mental health outcomes, healthy eating, rest, all the things around a team experience that can uplift that positive space. I already mentioned about my example in coaches, but that is in our space as well as coach training. So, we're also uplifting literacy. We also want to ensure that coaches know why it is important to coach a certain way that uplifts and provides positive feedback to the kiddos playing. I often use the analogy of, you can open a door with a stick of dynamite or by turning the handle, and one's going to have long-term impact and the other one is going to keep that door opening and closing as needed. And our coaches, do they have awareness of how to get those outcomes in a way that's meaningful for the kiddos? And finally, adults and volunteers within clubs need to know how to recognize and refer individuals to appropriate service providers. So that's a big part of this too. And I'm going to talk about the resources that we have cooking at Hockey Sask. But it's important in your local areas to know who we need to refer to, because we're going to need referrals for the nutritionist to come in and keep, some positive, healthy food habits in front of the kids. We're going to need some literacy for mental health. Maybe it's mental health first aid, but we're also going to need crisis management services for when there is a mental health. We can call it a crisis within a team. Maybe a team has experienced a death of one of their own or someone close to the team, like a parent. And unfortunately, that is a reality in a sport like ours. Does the team have access to support right away? Is there a mechanism in your organization to know who are we going to call? How are we going to budget for it? How are we going to support this team? Because that's a moment you don't want to be left scrambling, because the players are going to need that triage of service straight away. So those recommendations are wonderful, and let's talk about how we are divvying up those responsibilities. They're a call to action, not only for the minor association level. In this research paper, it was referred to as club. And how do we activate it there? But also, is it supported from the top down? So the following recommendations also come from this research. National sporting bodies should be responsible for development and dissemination of policies and resources related to approaching mental health prevention and promotion and care in community sport. And they should also create partnerships with service providers. So right now, Hockey Canada, using this same research, is taking that call to action. They have a mental wellness committee that is organizing all those ends. So who should we partner with? Who, what emphasis can we put on prevention and support to help local associations? So using the power of the national organization to build those partnerships. Do they have anything for you today? Not exactly, but that work is underway. And then the other recommendation that would apply to the provincial organization is that in this case, Hockey Saskatchewan should be responsible for organizing and implementing mental health literacy programs and training in associations and clubs. So this is a bit of a two-way street. So while we are today appealing to you to make this a priority in your space, we also are right here beside you, helping you vet resources, build partnerships, and bringing resources straight to you. And finally, it's the responsibility of the clubs, or in this case, minor associations or leagues as well, to implement mental health prevention, promotion, and care policies and resources. It says provided to them, but also I would say to empower our associations to use resources that they find or that they think are appropriate for their space. A lot of local resources might be included there. And finally, as we wrap this, look at the research, it's fair to say that sometimes it's the intervention itself, the literacy clinic that you hold, or the the resources you provide that are doing the work, but also just having them there, just being an association that has put a stake in the ground to say, we do care about this and this is something we want to resource, can also be enough to start reducing stigma, to create a safe pathway for a young player to say, well, my association, maybe they haven't given me any personal resources yet, but they are talking about it and they have some resources. I feel like this is a place where I can, I have a path forward. So it's really raising the flag on caring for the space that, evidence shows is also a good outcome to have. So it's, you might consider it the placebo effect to a degree, but it works at both ends. And I share that because I hope that we realize this is not an all or nothing approach, that when you're organizing in your associations, you're not concerned with, are we doing, can we do it all? If we can't, let's put it off to next year. Start with small things because every little bit will matter. All right, at this point, I'd like to invite, we have some representatives from Saskatoon Minor Hockey Association who have been already doing a Know the Score program with Wellness Champions. And so I've invited Kelly and his other representatives to talk briefly today about what that has looked like for their association, how they've been delivering it, and some of the highlights that they would recommend. So I will pass it over to you, Kelly.
Thanks, Faye. Thanks for having us on here. Also on the call is Mitch Berg. Mitch is our main go-to person, our initial contact for our teams and our families and our wellness champions in the area of mental health or mental performance. So I'm glad Mitch was able to take the time. Mike Gawley, our Know the Score wellness committee chair, sent his regrets. He was supposed to be on the call, but he had a little problem come up that he can't get to the computer in time. So he sent his regrets. But yeah, we've had a Know the Score program. It was a drug and alcohol awareness program since around 2000 or 2001. And then about 3 years ago, we kind of realized we had all these different contacts we were using for various recommendations to teams, just as you discussed, Faye, when something comes up, so we developed a bit of a Rolodex for people to contact if we needed to get them some help. And we thought, well, why don't we just try to roll this into something beyond just drugs and alcohol? So it became our Know the Score wellness program. And again, we just finished our second full year of that. So we basically touch on kind of diversity and anti-racism is one of the areas. Cannabis, drugs, alcohol, vaping. Vaping's a big one. That's another area. Online gambling, building healthy relationships, sexual consent, that type of thing. Some anti-bullying, and of course mental health, mental performance. So those are the areas that we and each team from U13 and up in our association has a wellness champion. So we basically took the old, if everybody remembers the COVID rep every team had back during the COVID days, turned that into instead of a reactive person reacting to what was going on, a kind of a proactive person that would step up. We make it mandatory that they're not a coach, they're not a manager, they're a parent on the team that wants to help out, and they don't need to know anything about hockey, just care about kids and trying to help out. So they're kind of the conduit to the team. We educate them. We record the training they get. We disperse that to all the parents, and then the wellness champions, kind of the team liaison, the rep to anything comes up, they work through them and bring it forward. These would be all those areas I discussed, off ice type things that we discussed. And then we direct them to the person that can help them the best, whether we putting on a presentation for a team, or educating an entire team. Maybe a whole zone of our association has an issue that we want to help out with. So we bring in, this year we brought in all the U15 teams in one zone to deal with a problem that had occurred on one single team, but we thought it would be healthy to help all the kids out. So around use of social media and consent and all those kind of things. So it was good to be able to have these people right at our fingertips. They sit on our committee actually, and so typically just on this topic on the mental health and area, Mitch is our first contact. So something comes up, usually I'll direct Mitch to get the ball rolling, and he has other professionals he works with and colleagues that he can refer to if it's something that's not in his particular wheelhouse. So Mitch, I don't know if you just want to bring it, talk about maybe some of the things that you've talked to teams about and parents about and kids about and families about, just to kind of give an idea of what you encounter during the hockey season.
Sure. Yeah. Thanks, Kelly. I've been reached out by various people for various reasons. Some for just mental health concerns, some for mental performance. Others is for team presentations, whether it be on team building, whatever it might be. Maybe a team is struggling. Maybe a team is want to take a more of a proactive approach to get all, I guess, on the same page moving into the season. So, in regards to mental health, it kind of depends on each person. If it's somebody who's maybe struggling with their mental health, and just me speaking with them is helpful. If they're looking for more, um, I guess, intense therapy, that's something that I do often refer out to. Not that I'm not able to do it. I just want to kind of make sure they're provided with the best care. And oftentimes it's maybe seeing someone in person, and I'm not really able to accommodate that as much or as accessible. So I try to, again, like Kelly said, if there's a concern that comes up, um, they'll be kind of put into an email with excuse me, with my contact. And then I would speak with the parents, speak with the wellness champion if so, and then kind of determine what level of care this particular person needs, and then move it from there. There was a few even, minor or not minor, I guess some incidences last year with teams and bullying and some coaches and whatever else. But overall, I think it was just kind of communication was the main thing, and try to get everyone on the same page and recognize we're here to help the young athletes strive, not harm their time playing the game.
Faye, did you want me to touch on Connect Sport while we're here, or did you have that as a separate item later?
I have that as a separate one, so I might ask you to jump in after, but
Sure.
let's pause that one for now.
Okay. Yeah. Anything else you'd want, Faye? I know you came to our presentation. Anything else you want me to describe or expand on or anything?
I think we'll leave it with that for now. So thank you for sharing that. And I also, put you on the spot, Kelly, to say that I know that I certainly have sent a lot of minor association leaders Kelly's way, because I know he's, very happy to share about the benefits of that program. So I know you didn't make that invitation, Kelly, but just I do often send folks your way to talk about what's happening at that level, right? So it's a very good model that Saskatoon has going on. I did get to experience it this past year, and what stuck out and how Kelly just described it is it's not, like I mentioned earlier, it's not an all or nothing approach. It is getting connected with different individuals that can help in different situations, because we don't know all the situations that are going to come up. It's, somewhat different than maybe our physical safety. If you have a team trainer who can then refer to a doctor and then refer to the specialist up the chain. To Mitch's point, some people want preventative pieces, some people need support, some people need more support than one person has in their scope. So it's all about networking, sharing, and finding the right people in the right moment, and not to be intimidated by what situations could arise, because we simply just want to be mindful of what can come up and be nimble to support where needed.
Yeah, so the only thing I'd offer, if anybody wants, on our website under the safety tab, you'll find Know the Score Wellness there. If anybody wants to look in that area, they can have a peek. And like you said, we're always open to chat with about any questions. Andrew Bailey's on the call. Andrew's started with SMHA recently in our player development, manager of development and hockey operations. So a lot of this will fall under his wheelhouse as well. So we'll have several people here that we can point you to talk to, and almost all the people we have on our committee that are the kind of the experts in their areas are all willing to help out. They're not Saskatoon centric. They're willing to help out wherever they can help out. So yeah, don't ever hesitate to call and ask, or email and ask if you're looking for something.
Thank you, Kelly. Thank you, Mitch. We do expect your phones will be ringing to get some support. So part of why I wanted to bring us together today as well is when my phone rings and people say, well, I've got a call from so-and-so and they want to help us in a certain way with our mental health. And we haven't, number one, we don't really have a plan and they just kind of came to us. We don't know, are they right for us? Which we do. And I don't have that answer. I can't always say yes, no, or otherwise because it's very situational. But I wanted to offer a few things for your consideration as you put together a mental health plan for your association. And when I say put together a mental health plan, I don't mean to say like, let's get a big strategy going necessarily. It could be, just what's a goal we have for this season, or what's one area of focus we have. So let's start thinking about that. So we want to be mindful when choosing our mental health and wellness partners. I like to kind of share the difference between advocates and experts. So we've had folks come our way who, from the outside looking in, if someone wasn't really sure and they came to you with a bit of a sales pitch, and that might sound a little crass, but that's the reality. And the sales pitch is about they've played hockey or they've played another sport or they have this wonderful life experience and they do keynote presentations or they want to help. The intention is always wonderful. Their experience is valuable. And yet they might not always be experts in the space. And what I mean by that is in this space, by someone maybe doing a keynote to a team or a team building situation, what Mitch described, because Mitch is an expert, is that someone might come to him and in a team building session that's about making sure we have good team communication. And they might have the aside after and say, I'm really struggling and I need to talk to someone and I want to talk to you and this is what I want. Mitch will know it because he's an expert and a professional in his field, whether that is something that he can carry forward ethically or whether he needs to refer it. He can make that decision because he's trained to make ethical decisions. Sometimes the advocates, as well intended as they are, may not have that training. That's not to say we don't bring in mental health speakers or folks with experience. But what we want to be careful of is bringing those folks into a space where they could be vulnerable to being their role is assumed to be something that it's not. And they may not have the ability to delineate what's going to be best for that player, coach, family in your arena. So what you want to look for in experts is truly, education, background, reading their experience, and because experts might come to you in that same approach and say, I have skills I can help you with, I want to help you, selling their approach, and that's fair too. But do a little background checking, and it could be as simple as looking at their website and seeing what approach are they bringing. Are they bringing a life experience approach and a testimonial? Or are they bringing, evidence-based skills and training that they want to support? Both have their place, yet they're not interchangeable, is the main point I want to bring across to you. Then we can talk about the different areas of mental wellness that we can support. So there's the proactive approach that is often lumped into what would be called mental performance. So mental performance is bringing skills to our players and our teams that offer them a boost in how they perform, but can also be protective against negative mental health outcomes. So it's kind of twofold, but the approach is more, we want you to be able to focus when you play. We want your team to be cohesive. We want you to have mindfulness. We want you to be able to keep your performance arousal at an effective level. All of these different things can be brought forward. And depending on the age of your players, mindfulness is a great aspect for younger players, and focus might be more sophisticated for older players. So you can bring in mental performance experts to work in that space. Then there's the space of awareness. So that is a lot of what Saskatoon is doing. Literacy, mental health management. So what are you going to do as a policy if a coach goes on stress leave? Do you Are you able to handle that in the same way if they went on a medical leave? Like, are you prepared to manage those situations? So having as an executive, as a minor association, the ability to know what impacts mental health can have on the people, but also the operations of what you're doing, and ensuring folks have literacy about what, so there's a mental health situation, what does that mean? And then there's the reactive approaches, which are important to have. Like we already talked about crisis management, which is a big one. So do we have the proper resources to deal with situations as they arise? And this sort of fits into my next point, with the sort of adjacent activities. So you might have a therapist counselor in your space doing something which is very, the approach is very direct towards mental health outcomes, but the adjacent activities could be, like Kelly said, we needed to have someone talk about social media and consent, because when those situations arise, the next problem is poor mental health outcomes. So it can be, yeah, I'm going to talk a little deeper about what some of those adjacent activities are. But when I say, when you're trying to bring this into your organization, maybe there's still stigma where you are. Having these adjacent activities can start to really pull that thread as well. And the outcomes are still beneficial for mental health. So next, I'm going to take us through some opportunities that are available in any of those categories. And this is probably just scratching the surface on what is out there, but these are some of the different groups, agencies, partners that have come our way with some interesting approaches that we've done a little bit of background and screening on, not necessarily big deep dives, but I thought we could share with you all so that you can kind of have a sense if they come to your door, or if you're looking for someone in a particular space, you have a little bit of background. It's important to know that these folks are not paying us by any stretch. So I'm not here, advertising on their behalf. They're simply organizations that I think are appropriate for hockey, appropriate for different size associations. And they've just been vetted for their expertise only as a starting point. So there are things I would encourage you to look at or start considering. The first is a partner we worked with for a webinar earlier this season, Dr. Jennifer Fraser, who does a lot of work in the space of anti-bullying and the impacts of psychological unsafe environments. And so after our work with her doing an informational webinar, which is still on our website, you can have a look. She also would be curious about doing a pilot opportunity with a team or a few teams to do some brain training to reduce impacts of bullying and bullying behavior. So it's a little on the sophisticated side, yet there may be teams out there who want to really, I would consider this as a performance enhancing opportunity while also creating psychological safety. So if that's something you think would be of interest, starting with the more sort of sophisticated side of things, have a look at her work or reach out to me. Next is Hone Athletics. I think they've worked with a few hockey teams and sport organizations in Saskatchewan already. They are operating with a group of leaders who are both mental performance consultants and therapists who have created a really interesting model on a holistic approach to team mental health management that starts with coach awareness and literacy and builds a process into a team structure. So what their application looks like is they have an actual app that anonymously collects checkpoints with players. So a coach would have the interface, the dashboard, where they can send, I know teams use different platforms, so I know some of our older players are used to having this mechanism. They'll send out a checkpoint. How are you feeling today? Did you get rested? It's all anonymous. The players can offer different feedback through there to ask coach for more follow-up, but the coach can check in on their team in the morning after a game or the day before practice and say, okay, like the team's pretty exhausted. We just had a number of road games. That's going to help me manage how I want to make this practice work. So it's an ongoing check-in with everyone, which is the important part. Because if you've ever coached, you're trying out there to ensure that you're checking in with all your players. It's not always possible, and not all players are willing to, open that can of worms and say how they're really feeling in a specific day. So it creates a normalcy to that. Then they also provide both therapeutic and performance education opportunities, as well as doing some the coach archetype work, so that we are, as a team, can kind of figure, this might be a little more sophisticated for maybe an older team, but for the coaches to know how they like to communicate with each other, the different personalities that are involved in organizing. And then they can a la carte some of the presentations that they can do to your team or your association. So it's kind of hinges on this app that they use, yet it has a broader model around it. Next is Connect Sport, which is very much an education-based model of offering what we've already talked about, creating literacy, offering how to activate support, and building connections. So their model, which if you are thinking of what could our mental health strategy be, I think we could borrow a page from Connect Sport here, is looking at identifying what mental health needs are out there, what are the early warning signs, what are the major issues confronting youth today that could lead into mental health outcomes, modeling good mental health, and this goes into the preventative nature of things. So supportive behaviors, reducing stigma and accurate language, or offering accurate language, and creating inclusive environments. And then link building. So we talked about this already, making sure that we're being mindful about the connections we're making, so that when we need support, we know who to go to. And then they're offering this at different levels for coaches in your association, parents, and youth. Kelly, is there anything you would add just at a high level about your experience with Connect Sport?
Yeah, well, we did. I just wanted to pass on that we worked with Connect Sport this year. We basically treated it like a coach certification that Hockey Sask would have a standard. So basically, we had every team from U13 and up had to have at least one registered coach have taken the Connect Sport course, and we found it to be it was relatively wasn't a huge burden. It's 45 minutes to 60 minutes of time with a pre-test and a post-test after you've taken the education to kind of learn what you've learned, or learn a little bit more about what you learned. And yeah, I just think you've hit the nail on the head. You mentioned a couple of times it was really about improving literacy amongst our coaches, trying to, if it starts at the top with them, reducing stigma and maybe normalizing some discussion on it amongst a team. And I think the biggest outcome though came from it from an association, just wearing the hat of the association. We literally had nothing but positive, not one negative on the whole thing all year, other than a couple technical things that some non-techie people had trouble getting on or logging in or whatever. But other than the actual content was nothing but positives. And found out that a lot of our coaches actually enjoyed it, because it's not something none of us ever really do, right? Learn about mental health. You're not doing it on your own. So I don't know. I think they walked away a little bit more confidence in at least being able to have a discussion with their teams, and maybe even to be looking out for things that they might not have before, and maybe having the willingness to go to a parent and say, Bill hasn't been the same kid. He was like this in October, and it's, December now, and he's been, a little different. Maybe you haven't noticed, but I just wanted to pass it on. Those are the kind of things we're looking for, that maybe just catching something early, then it might save something down the road, right? And I don't know, Mitch, if you want to describe, I know you kind of helped us make a decision to go with Connect by looking at it yourself.
Yeah, I thought it was a very unique program, very well informed program. I think it touches on a lot of important things of areas to look for, but also recognizes that the coaches are not the therapists, right? They are the ones trying to recognize maybe they see these kids multiple times a week, right, throughout a season. So they have a lot of connection with them and like they see them. So just being able to see that, and I will say I've taken a lot of those types of courses in my own work, and I would say this is quite unique to it. I genuinely enjoyed this because it did have that sports aspect to it. But yeah, no, I thought it was a very well delivered program.
Thank you both for that. And what I'd love to hear in that is the antidote to what I get across my desk from coaches saying, I'm nervous because I feel like I'm going to have the responsibility of someone who's going to have a mental health challenge, and I'm not going to know what to do with that. I feel insecure about it and unsure. And you nailed it beautifully. It is not about being everything to that kid. It is being one person in their life that can help flag where they might need support. And that will make such a huge difference. And there's families who have experienced loss who have shared that with me, that, it not blaming coaches by any stretch, but looking back, you go, we could have collectively brought our notes together, but we didn't know we were supposed to do that. And we didn't know that that was our responsibility. And so by empowering coaches, that it's no different than if you see a kiddo who is sluggish because they haven't been eating before practice, a coach would probably never, you know, hesitate to say something to them, their family, and get that corrected, giving them the tools to do this in all aspects of a kid's health. And I also like what you said too, Kelly, about not being afraid as an association to standardizing, what education you need of your coaches, right? Those standards exist through Hockey Canada and Hockey Saskatchewan, but you also have the power to say, this is a big need for us, so we're going to make sure that this is something that you do, and it's for your benefit. It's not punitive; it's helpful.
Yeah, we treated it the same. We were going to fine them if they didn't get it by the December 20th deadline, just like a coaching certification.
Yeah. And some smaller associations who maybe don't have the depth chart of coaches would maybe find that it's a matter of, we have this gift to give you, which is more training, and it's a great opportunity. So there's many ways to approach it. The Coaching Association of Canada offers one online webinar. Again, if you want something a little more just grab and go, then maybe a partnership with Connect Sport. When I checked earlier this week, their mental health and sport module was listed as free. So that's cool. And when sometimes they add a price tag to those, and they're very nominal. I don't think they run more than $10 to $30 with certain times of the year. Volunteer Appreciation Week, Coaches Week, they offer some free ones. So a simple, point towards that module with the NCCP locker program. That's where that's housed. And then they also have some adjacent modules too that I've listed here. So positive sport environment, bystander, anti-racism. We'll talk a bit about culture next and the importance of it. So I talked about what's adjacent to mental health positive outcomes. Cultural training is important because you need to know who is in your minor association and what their particular needs might be. For a lot of Indigenous players, it's one thing to perform in the space that's been offered to them, but there may be particular needs that they have that our hockey system doesn't always support. And it's meaningful to consider what other needs are. And that can also be LGBTQ2IA plus athletes. Like, what are these other cultural spaces that we can improve our literacy in to be the best coaches and administrators for our players, so that we can not only help all mental health outcomes, but look a little deeper into particular needs of underserved groups. Positive Coaching Alliance, who we've partnered with as well, offers some different training around, coaching with empathy and considering the athlete as a whole person. All right, these types of resources are excellent, but we can't reach any of them if we don't resource for them. So I will be honest to say that, you know, often Hockey Saskatchewan is asked with, well, who are you going to get and partner with that we can have all this? I am certainly working on those spaces, yet I want you to feel empowered to find the resources that are meaningful for the size of your association, the location of your association, and what your players, families, and coaches need. So I ask that, you know, if we are prioritizing for player outcomes, such as power skating camps or bringing in those nutritionists, whatever it might be, have we considered putting this in our budget the same way we are doing for power skating, right? If power skating is an important tool, how can we make that happen? I've talked a lot about not to overwhelm your budget, because you can do this incrementally. This doesn't have to be we're making a big contract with a provider this season that's going to be several $1,000s. It could be, hey, we're going to grab a couple of those free modules for our coaches this year, and then next year we're going to do some team building sessions with an expert and so on. So I implore you to ensure that if you have positive player outcomes as a goal of your association, which I hope you do, and you're resourcing it with on ice skills, that you consider what other areas you can resource the best player outcomes. And we talked about this with coaches. A lot of coaches come with, I have my skills built in. I know how to teach kids how to skate and pass and shoot and play their positions. A lot of coaches come with that experience already. We're training them in that space. So where can we add on to that coach's expertise? And that will come with our own resourcing of it. The next call to action I have for you, which there will be more to come on this, but I wanted to plant the seed today, is a lot of not great mental health moments are born out of what's happening off the ice and in the lobbies and in the team chat messages and all these things. So I do ask that you start considering what your bystander policy will be. Is it, if you have one, is it working for you? What ways can we manage the culture of our association to ensure that we have good buy-in on positive mental health outcomes? So I will ask you to start considering, you know, some different options we have here that will be coming from my desk soon, but consider the ways from a policy governance standpoint that we can support the outcomes we want here.
Faye, do you have any kind of template of a bystander policy that you've seen?
That's what I'm getting at. So thank you for asking that question. I will be providing you with a menu of different policy structures, all these different types of activities that I will ask all of our associations to say, this is what we're doing. Because for a larger association, a policy might be the thing. For a smaller one, it might just be, we're making sure that we have a community pledge of how we're going to act in our arena. So more to come on that. I see that we've gone a little over time here, so I just want to offer, and it's not coming up here very well, but I'll offer that on our website under the Safe Sport module or drop down, that you'll find different categories of mental health resources, often categorized like I've talked about already today. So those preventative things, those ongoing resources and crisis management pieces, you are welcome to have that as a link on your own page, because I'm going to be keeping it updated. So use that by all means, but also consider looking at that model as something that you want to do in your association for who are the local groups that or experts that you want to work with there. So our website will have that information. And if you have time to stay, I would love any questions.
Faye, did you get any feedback at all on the PCA online course that people needed to take for the as part of their maltreatment suspensions?
So I did some very personalized, I got on the phones and started calling players, coaches who took it to get that feedback. So what Kelly's referring to is for players who received maltreatment suspension, we required them to do an online training module that was tailored to whether there's a player one, there's a coach one, there's even an officials one. And the feedback, I'm still summarizing, so it's in the works and I can send out more of a formalized report. But I'll say today to Kelly that I was pleasantly surprised that I had my own bias and assumption, thought that this was going to be reaching players who were aggressors out on the ice and did this training and thought, you know, that was, you know, a waste of my time. I was surprised that there were many who said, you know, there was one that said, I wish everyone would take this before the season. I really didn't mean to blow up like that. And this course helped me manage my emotions better and made me think about that a little bit and how I want to be for my team and feedback about wanting to be those team leaders. There were a few who were kind of indifferent about it, and that's to be expected. And I also, my learning this year was that it might not have been the most appropriate for all ages. I would say, I think it went out to some actual senior hockey players, and I'm not sure that was the most appropriate place for it to be received. Yet overall, we do plan to continue with it. And also that module can be offered to, you know, your players, coaches. We can get a bulk purchase price on it. So it would be about, I think around, if we, depending on it's on a scalable bulk purchase, but I'll say maybe we could get something around, you know, $20 to $25 per module for players and coaches and anyone you want to take it. So some groups might consider, if they're a small organization, that they might have all their coaches take it or all their teams of a certain age group, because it's probably not appropriate for anyone under U13. I don't think I mentioned there's also a parent module too. So if you want to use it as we have, in addition to the maltreatment rule as a educational component to a suspension or disciplinary action, we would love to help you access that. And if you want to use it as a proactive piece, for those who may not know, the concept of it is very general yet important. It's about honoring the game. It's about showing up as the best person to support your team and yourself, and to, you know, be in a space where you are honoring the sport that you came to play and help take out of those really intense emotional moments and see the bigger picture.
Thanks, Faye. That helps a lot. Yeah.
Okay. If there's no other questions, I'll just ask you to keep in mind, what can you do to have preventative measures for positive outcomes, reactive measures, and increasing awareness and education, big, small, or otherwise, and how can you resource that? Because we will continue to share resources and build partnerships, but the most effective approach will be for you to have resources for your folks in your minor association. And we're happy to help with that. And stay tuned for what Hockey Canada will unroll as well, as they get more intentional about this space for our associations. Well, thank you for your time. Thank you for sticking with me for the extra few minutes. And by all means, if you ever have any questions about mental health in your space, whether it be emergent or otherwise, by all means, you know where to find me. I appreciate you taking the time today.